How to explain about a procedure in communication scenarios in PACES. Firstly, you have to introduce yourself and to confirm the patient name and age. Then explain about the agenda of the meeting that we are here to discuss about the procedure. This procedure was prescribed for you in the best interest of your condition. Briefly explain the indication and the benefit of this procedure. However, as any procedure, this procedure might have some risks and complication, but be sure that the benefit usually outweigh the risk of this procedure. That's why we are explaining this procedure for you. Then, as general advice, please try to draw while you are explaining to the patient what you are going to do. Don't forget that you have a paper in the exam and you can draw through it. Then, the cornerstone for any procedure. If you forget everything in the exam because of the stress, please remember these three things. Use these steps while explaining any procedure. At least do these steps to fulfill your time, which are before and during and after. So, before the procedure, we will be sure that you are not taking any blood thinner medication that might lead to some complication like bleeding. We have to do some blood tests just to be sure that your blood is not that much thin and everything is okay regarding your blood workup. You will be admitted either to the daycare unit or to the department or according to your scenario. So during the procedure, we will be sure that you are not in pain because most of the patients in the procedure they are worried about the pain. Please reassure that the pain doctor will be there and we will be sure that you are not in pain. Plus, we will numb the area of doing this procedure, injecting or putting some numbing agent over the skin. Assure him about cleaning the area of the procedure and the way how they are doing this procedure, either using the scan or camera or needle. Then explain about the after. After the procedure, be honest that there is some complication might happen. The commonest are two P's and two I's. P's, pain and bleeding. The I's are infection and injury to the nearby organs. However, our team are expert and professional. They did this procedure many times, trying to make this side effect or complication very minimal. Be sure that after the procedure, we will let you stay for a couple of hours just to monitor your vitals and your condition to avoid any complication might happen. Sometimes you have to offer some person or someone to drive him home, especially if he doesn't have any company. Fifth, the consent form is crucially important to offer, and the patients might sign this form after reading it carefully. Tell him, anytime you change your mind, this is your right to withdraw. Next step, you have to remember that you will give him follow-up appointment for disclosing the result of this procedure. Finally, the closure of the meeting, you can say some red flags and safety netting he should know. If it happened at home, he should ask or seek medical advice with his GP or immediately to the emergency department according to the seriousness of these complications. Don't forget to offer him leaflet brochure website and to check if he understand every step during this meeting and about this procedure. Thank you.